it's a girl Millie. In this day and age, we are encouraged to identify a problem and create a solution for it. And that's exactly what I did. Tell me why we are still using books to register patients during medical camps. Don't worry, your girl got you. I came across this post and I thought of designing a set of digital forms to help in the continuity of medical care. I will walk you through a medical camp linked forms workflow. So you only need an Android phone. Go to Play Store, download ODK or Combo Collect. Then with a shared QR code, you get to access some of these forms. So we shall click on Start New Form, and we shall start with the registration form. Since it's the entry point for all patients attending the camp, where each and every patient details are entered. Once a patient is registered, the form automatically generates a unique patient code which links to all their records across every form. So for this case, James will be a HRIU. As you can see, the registration date is also being auto-populated. Then we shall do the consenting. District, we shall do Tetu. Then as you can see also, there's a patient code which is being auto-populated. Patient name, Jane. Location will be Tetu. Then female as the gender, then born 2018. As you can see also, the age is being auto-calculated. Single, then telephone number must be a 10-digit number. So for a minor, we can use the guardian's phone number. Finalize it, then send it. Once you're done, head back, then refresh your forms. So the next form is the consultation form. Once a patient is registered, the consultation form retrieves the registration data using the patient code. So click on the consultation form, then must do the consenting, then key in the patient code TAT 8042. So as you can see, it has auto-populated all the data. So next, for the blood pressure, 120 and 80. So for the blood sugar, we can do 5.6 for demonstration purposes. Then is the patient on medication? So if yes, there is a specification or listing. So for this case, no. So any deformities? If yes, there is also a description you have to describe. For this case, no. Any infection? So you also need to specify. And for this case, no. Hemoglobin levels. So if he or she was tested, you also need to select yes, then key in the number. Then for this case, no. So was the patient born with the cleft lip or palate or both? So yeah, for this case it's a yes, so we shall select both. So has the client undergone any surgery before? So if yes, you need to select it and specify also the year in the hospital. So for this case, no. So any other medical condition? If yes, select it and specify. For this case, no. So is the cleft visible and surgically correctable? Of course, yes. So is the patient fit for surgery according to assessments? Yes. So for consenting for a minor, you have to do also the consenting with the guardian. So click on yes, then you have to key in the guardian's name. For this case, I'll click say Wambui as the guardian. So surgery appointment date should be 31st for demonstration purposes. Then doctor's name, you have to select it, finalize it, and send it. So the next form will do the nutrition form, which evaluates the patient's nutritional status before surgery, which helps determine whether the patient is fit for surgery or requires any nutritional support. So head back, start new form, then head to nutritional evaluation form. Consenting is a must. So key in TET, TET 8042. So as you can see also, the data is auto-populated. So wait for this case, 45, then 155. Then as you can see also, the BMI is also being auto-calculated. So it's normal. So does the patient have any feeding difficulties? If yes, select it and specify also. So for this case, no. Then the nutritionist name, you have to select. Yeah, and once you're done, finalize it and send it. So the next form is the orthodontics evaluation form, which helps or provides insights into the patient's dentition. So head back, start a new form, then we shall select on the evaluation form. Then next, consenting is mandatory. TET, remember you have to key in the patient code 8042. It populates the data. So the type of dentation, select primary, then yes, then class 2, cross bite, yes, then open bite, yes. So treatment, yes, then treatment be aligners, then any notes. So for this case, none. Then you have to select the doctor. So finalize it, then select it and send it. So once you're done, you'll head to the next form, which is the speech evaluation form, which helps us to access their communication ability. So yes, click on start new form. Then consenting also is mandatory. Patient code TET 8042. As you can see, it has also auto-populated the data. Next, so can the patient speak? Yes. So for this case, the label I select fair. So yes, then the speech therapy needed, yes. So then I'll have to select also the speech therapist. For this case, James. Finalize it, then select on it and send it. Yeah, then head back. So we are done with the 5 forms. So the next form is the cleft surgery form, which for this case it will automatically compile data from the previous 5 forms, allowing the surgeon to record the surgery's outcome and note any complication. It also captures the type of cleft, surgical procedure, anesthesia used, surgeon's name, and the post-surgery evaluation. So yeah, now refresh your forms. So click on the cleft surgery form. Then consenting also is mandatory for this case. So patient code TET 8042. As you can see also, it is auto-populated all the data from the 5 forms. So click on next. So the date of surgery performed, 31st, okay. Then the anesthesia administered, yes. Then type of surgery, cleft lip and palate surgery, Then surgical notes. For this case, I'll say the surgery was successful. So any complications, if yes, you also select yes and give out the details. For this case, no. So follow-up needed, of course. So next month will be our appointment dates. So follow-up instruction, that will be on a monthly basis. Same, and once you're done, you also have to select the surgeon. So for this case, I'll select Melly. So finalize it, then select on it and send it. And we all done. So as you have seen, all these forms are interconnected. Once you enter the patient unique code, the details are auto-populated across all forms. So this digital system helps to ensure that the data is accurate, organized, and ready for research, helping us better understand our community and improve health outcomes. If you're interested in using such forms for your medical camps, feel free to holler me up on 0783 115 734. Thanks for watching, and remember, innovation begins when you identify a problem and create a solution. Thank you.